Thank you. Thank you. In the summer of 2014, Lindsay was going to be a senior in high school. Three-sport athlete. She was at basketball camp. When she was running down the floor, tripped up, landed on her head. The girl that tripped her up landed on her, hit her head again, double impact. Was momentarily knocked unconscious, called her parents, they came and got her, took her to the ER, CT scan was performed, all was negative, everything was fine. And they told her to go home and rest, it would take time. 2 weeks later, she was seen by her family doctor, and he gave her the go-ahead to return to participation in sports. All I did was a little finger to nose test and a little balance test, which at that time she passed, and he said, "You're good to go." Well, the mother knew her daughter wasn't the same since the concussion. And her daughter was emotional, memory lapses, not eating right, and her mother knew that I've been the team chiropractor for Gaylord High School since 2002. And she knew that I worked with a lot of the athletes, so she brought her into the clinic. Now, I had never treated a concussion prior to this. I had seen concussions. I had treated post-concussion from auto accidents, but I'd never seen anything like this. She walked in, and she had what I call the 1,000-yard stare. This was not the girl that I knew. And she's best friends with my youngest daughter. I watched this girl grow up. And it was not the girl that I've known. She just was blank, very rigid with her neck. So I did what a chiropractor does. I did a cervical spine examination, and I found exquisitely tender suboccipital muscles. Now, her presenting complaints were daily headaches, dizziness, balance problems, concentration problems, emotional, irritability, decreased appetite, not sleeping well at all, going into anxiety and even a depressive disorder. So I began to do soft tissue work on her suboccipitals. Very easy, gentle adjustments. Did therapy on her. A lot of soft tissue, a lot of therapy. And then at the time I had Swiss balls in the office, and I had this apparatus that's called OTIS, oscillating technique for isometric stabilization. It's a circle, and it has these ball bearings in it, and you just got to get it going, smooth and rhythmical. And she couldn't do it. She was just clunking all over the place. She couldn't even sit on a Swiss ball, really, for any amount of time without falling over. In about 30 days, I had the headaches gone, I had the dizziness gone, everything was ready to go. She had already been cleared by the MD, which, by the way, the Michigan High School Athletic Association says that you have to have an MDDO PA or a family nurse practitioner clear them to return to play. Everybody that really doesn't know what they're doing with concussions gets to tell them when they can go back to play. That's some things I'll talk about later on. But I got her back. She was ready to go back and start volleyball. She's in volleyball tryouts. She's walking away there during serving practice, and the girl serves it, nails her right in the back of the head. Runs into the locker room, is laying there. My daughter gets in there. She's all emotional. She's crying, super bad headache. She brings her back down, and we start it all over again. This time she misses all of volleyball except for districts. I got her back for the districts, and all I did was chiropractic care to the cervical spine. We did some balance work. We did some OTIS, Swiss balls. I didn't know any better. I just was a chiropractor basically treating cervical spine with the girl that happened to have a concussion. I got her back, and she was able to play basketball that year, play soccer, went off to Central, and she would come back from time to time and tell me I'm still having concentration difficulties, I'm still having some memory, but overall I'm doing pretty good. So that's Lindsay's story. Brody is star defensive back for Gaylord St. Mary. He is in the playoffs. This is in the November of 2017. Brody takes a vicious hit and is knocked unconscious. Now, I wasn't there, but Dr. Brian Oliver, chiropractor, is the team chiropractor for St. Mary's, and he's telling me it's scary. He gets out to the field, Brody's laying there motionless, and finally he comes to a little bit. They transport him in full spinal precautions. Same thing, ER, CT scan, all negative. They tell him to go home, he'll take rest and time. Well, a month goes by, Brody's not back to school yet. He's still having headaches, he's still dizzy, memory lapses, concentration problems, eye sensitivity to light, to noise, the whole works. His mom is in the grocery store when she runs into Lindsay's mother, and they're talking, and she says, well, you know, Lindsay had a concussion when she went and saw Ted Arkfeld. Renee made the appointment, Brody came in. Now, I knew Brody as well. This wasn't the kid that I knew. He came in and he had that 1,000-yard stare again. He was not happy by any means. So, cervical spine examination, guess what I found? Same thing, right? Suboccipital muscles tight, upper cervicals were subluxated, and we start chiropractic care. Very, very gentle adjustments on him. We do therapy, and we start him on a round of neuromuscular re-education. Now at this time, I have a device called BrainTap. How many of you heard of BrainTap? Dr. Porter was at, I believe, one of the conventions recently. So we got BrainTap back in 2016. BrainTap is guided imagery. It's about 700 recordings. It's a visor type. It kind of looks like Star Trek, to tell you the truth. And there's just a whole bunch of recordings in there to just get people out of certain brainwave. It's really autonomic nervous system treatment. So what Brody was having, he was stuck in what we call beta. Beta is what most of you are in right now. After the meal, maybe some of you are in alpha, you're starting to fall asleep a little bit. But beta is when we're alert and we're listening, but too much beta is also synonymous with sympathetic dominance. When you start to fall asleep and are really relaxed in the zone, that's alpha. When you fall asleep, that's theta. And when you get to deep sleep, that's delta. He could not get out of beta every night. He wasn't sleeping well. And again, he was heading into anxiety disorder, and he was becoming depressed because he was not back at school. This was almost a 4.0 student, and he wasn't back at school yet. So we started treatment. We started doing BrainTap on him, and we got him back to school. Now this one took a little bit longer because you see, after 14 days after the trauma, they moved from concussion to post-concussion syndrome. And the way that you treat that is totally different. So we got Brody up and got him moving, doing some aerobic exercising, and we got him back to school. Now he still has some residuals. I run into him from time to time. He still has some concentration issues, but his mom, the day that we released him, she was in the hallway and she looked at me and she busted out crying, and she came and gave me a big hug and said, "Thank you for giving my son back to you." All right. If you don't think that concussion is a hot topic, I called 7 and 4 News up in Traverse City Monday morning at 9 o'clock and said, we have this new baseline concussion program that we're using. Would you maybe be interested in coming out and doing a section on it? Diane calls me at 10 o'clock, comes up and says, "Hey, 7 and 4 is on the phone right now. They want to know when they can come out." I said, "Well, probably a couple weeks, right? Is that what they're thinking? They want to come out at 1 o'clock today." Good thing that I, wore my good shoes and everything that day. So this is what they filmed. So go ahead, Di.
It's a new tool that can detect concussions in athletes. 7 and 4's Connor Hansen spoke to the team doctor at Gaylord High School who is using the new tool. He joins us now live from our Petoskey Bureau. Connor, how does this work?
Mark and Kristen, this new test asks all the same questions as the SCAT-5 test the teams have used in the past, but using a phone or a tablet. They can now judge by the tone of the person's voice if it's been affected by a concussion.
We're the only ones in Michigan that have this.
Dr. Ted Arkfeld has been a team doctor for Gaylord High School since 2002. In that time, there have been big changes in how concussions are detected and treated.
We always caution on the side that the kid does have a concussion. We're not going to put him back in.
Dr. Arkfeld is using a new technology this year from a company called Canary Concussion. Using an iPad, he runs through all the same questions he used to ask someone who might have a concussion.
Repeat that back to me backwards.
Here he's giving Cole Bartow, a senior on the football team, a baseline test. The difference with this test is that the program will remember Cole's voice. And if he takes the test again with a possible concussion, Dr. Arkfeld says it'll be able to tell the difference.
The technology picks up any subtleties in their voice, and then let's say that there's just a little slurring of the speech, it'll pick that up, and then it's no-go. They're not going back to participation.
You're certainly nervous at first, it's going to determine whether you go back and play or not. But once you kind of get in the groove of answering the questions and kind of know what you're doing, then you feel pretty confident.
Dr. Arkfeld hopes to see other programs pick up the technology as well.
We got to get the word out about this because, again, it's our kids' brains we're talking about.
Dr. Arkfeld says another advantage of this test is that if someone is recovering from a concussion, doctors can use the same test to see if they're back to normal. Reporting live from our Petoskey Bureau, Connor Hansen, 7 and 4 News.
Thanks, Connor. Dr. Arkfeld says he plans to use the Canary concussion test for all Gaylord sports teams this fall.
All right, so if it worked so well for that, I thought I'd do it
It's a
again.
new tool that can
So
detect
we got, I called him up again one day, and this time they did come out at 2 o'clock. It wasn't 1 o'clock, but I still called them I sent them an email at 9. And so we have this new tool that we use, 2 new tools, and they ran this segment. By the way, this is all free advertising. Concussion is a huge topic, and people are searching for the answers. So, Diane, go ahead, please. You just gotta.
concussions. Dr. Ted Arkfeld in Gaylord is using 2 new treatments that he says can help patients get back on the field faster. The treatment involves a device called a Normatec. It sends neurological inputs to the body that Arkfeld says helps patients regain their balance. Brain tap is the second treatment. He says it relaxes the patient with soothing sounds and makes changes to the brain waves.
We've come up with a very unique treatment program for concussions that we are getting kids back to participation. We're getting them back to school. And even after they've had a post-concussion syndrome, which is symptoms that last more than 14 days after the onset of the injury.
If I wouldn't have came in here and done it, it was probably going to be an extra 6 months. And it just helps you speed up that process and get your brain to feeling that you and not like you with when you have a concussion.
The doctor says he's been working with Gaylord school athletes on concussion protocol for several years.
All right. This isn't anything new. I think he knew that what we do as chiropractors was brain-based. I think they knew. We always hear about miracles in chiropractic, but I don't think they were miracles. I think it was really working with what I call the forgotten nervous system, which is the autonomic nervous system. And when you really break it all down with concussion care, that's pretty much what we're working with, is the autonomic nervous system. So I'm going to go over a little bit about the epidemiology of concussions. There's estimated 48 million that occur, 3.8 million sports-related concussions, And then motor vehicles, 240,000. Now, it's important to remember, the rates are actually higher. These are only what's reported. And the research shows that high school kids will fail to report at least 50% of the concussions they sustain. Doesn't happen up in Gaylord. I almost got too many kids coming up to me saying they have a concussion so they can get out of wind sprints. But here's the problem. The real problem is there's a misdiagnosis. There's misdiagnosis at the ER. The ER, most of the time, will not commit to a concussion. They'll say, well, I don't want to call it a concussion, or they have the outdated theory that if there was no loss of consciousness, that it's not a concussion, and that's absolutely incorrect. Family physicians. It has been a battle with them up in Gaylord, but I'm starting to win the battle. One of my very good friends is on the sidelines with me, and he is a sports fellow. He wasn't even aware of a lot of things with concussion, the latest research. He was still under the old thought that rest in time. Get him out of lights and just put him in and check on him every hour and all that. And that's just not the case anymore. The research just shows that that's not how you handle these cases. And unfortunately, there's too many chiropractors that don't recognize the symptoms, or they're scared of concussion. And we've got way too many kids out there that are suffering. And I'm going to end with Logan's story that you saw on the section at the very in the closing. Top sports for concussion: rugby, ice hockey, American football, lacrosse, soccer, cheerleading. Okay, cheerleading is low down on the amount, but the worst cases I've ever seen are from cheerleaders. And so we've got...
Is that the flyer?
Yeah, see, I even know the position. Okay, there's the base, there's the flyers, but yes, the flyers. For those who don't know, the flyers are just exactly what they are. They're the girls that come flying down, and they either get an elbow or sometimes they don't get caught. And it is very, very, very severe concussions. Females always have a higher rate. It's the same thing in motor vehicle accidents because of slender necks, and the head gets whipped back and forth. So you'll always see, we had more girls with concussions last year at Gaylord High than we did the football team. We had 5 concussions on the girls' basketball team last year. None on football.
Interesting.
So where did I get all this? Well, so obviously, seeing these kids that I would used to seeing thriving and doing well in sports, seeing them walk into my office, whoa, sorry, seeing them walk in and not the kids that I knew, and know that they were not sleeping well, that they were suffering, I started researching and started taking some neurology courses, and I came across a course out of Canada called Complete Concussion Management. And what they did is they clued me into what they call the Berlin Consensus. And this is the premier research and article about how to take care of concussions. And the Berlin Consensus, every 4 years, researchers meet at a different city. Researchers and experts in concussion meet, and they write a new statement paper and say, this is what the research shows us. What the Berlin Consensus said, rest in time is not the answer. Get them up and get them moving. If they are in post-concussion syndrome, and that means it's been over 14 days and they're not any better, they've gone into post-concussion, you've got to get them up and get them moving. So if you have a kid that is in post-concussion, and when they ride in the car they feel sick, the treatment is actually getting them to ride in the car until they feel sick, and then have them lay down, and so you repeat that until they build a tolerance. You don't have them go home and get into a quiet, dark place and shield them from everything, and you don't have to check on them every hour to wake them up. Go ahead and let them sleep. They're okay. There's 7 major red flags, like if they lose consciousness, increased nausea, vomiting, dizziness, balance issues, then you send them on to the ER and you have them checked out. So the MDs do not know about the Berlin consensus. And I've had a real struggle with them because they're recommending rest in time, and then these kids come in and they're already post-concussion. It takes a little bit longer to get them going. So what's the mechanism? What actually causes a concussion? Well, the first one is that it's an acceleration, deceleration of the neurons, of the axons, billions of them. And it creates an ionic exchange, and they become very porous, and then it goes into what we call the excitatory phase. So there's 2 phases. The first one, right after an impact, is called excitatory or the electrical storm. That's where billions of these neurons fire, and they shouldn't have. And that's where you'll see kids kind of wobble, they'll go down. I don't know how many times I've seen a kid on the football field unbalanced, grab his head, come running off, crying, and then about 5 minutes later, they seem perfectly normal because that phase has left. Now, the dangerous phase sets in, and that's called spreading depression, because when all of this ionic transfer in the excitatory phase starts, it burns up ATP like crazy. And now the kids are in an energy deficit. And that's the reason the second impact during this time is very scary. If they are returned to play or participation too soon and they take another hit, it could create cell death and even more permanent cell damage, brain damage, and maybe even death to the kid. You've got to wait at least 7 to 14 days to let those ATP levels get back up. Because calcium bombards, what's the powerhouse of the cell? Everybody knows this, mitochondria. Mitochondria takes and manufactures ATP, so they're in an energy deficit. Our own MHSAA does not even have a requirement stating how many days they should be off. They only say they can't return to participation on the day that they had the suspected concussion. So too many of the MDs are telling these kids they can go back too soon. In our office, I tell them you're done for at least 2 weeks, at a minimum. And then you can't return them to participation based on clinical symptoms. You have to do a physical exertion test. So we do what we call the Buffalo treadmill test. We put them on a treadmill, we warm them up, and then we raise up the incline 1% every minute. We take their pulse rate and we ask them about their perceived exertional rate, and we keep going. And at the certain point where they say, I've got a headache, I'm feeling dizzy, that's when we stop, and we know that we can back off by about 20% when we take them through our rehab. But the important part is you got to get them up and moving. So they keep going through a Buffalo treadmill test every 2 weeks until they pass it. And at that point, if it's football, then they go back. There's no helmet. They just go back. They do drills, and we do a 5-day return to play. They have to have at least 1 week of practice before they can go back. I don't have any issues with our coaches up there. They're on board with everything. The biggest issue sometimes is with the parent. You know, the parents are sitting there going, get him back in. He's okay. It's your son's brain that we're talking about. Brain tap, these kids come in, and the first thing that we do after I do the exam and tell them you've got a concussion is I give them education and assurance. And I tell them, you're going to be fine. We're going to get you back. You're going to be okay. And they'll say, well, I had 2 other concussions, and I don't care. You take each concussion as its own separate entity. There's a lot of misinformation out there, and there's this one that, 3 concussions, you're done. It's not stated anywhere in the research. Now, if I had a son and he had 3 concussions and he's playing football, we're probably going to have a talk. Okay. Brain tap. Brain tap has been huge for us because these kids come in, they're insomniacs. They've got all the things they're worried about. They're worried about school. They're worried about, are they going to get back to participation? They're worried about, is their girlfriend still going to love them? They're worried about what college they're going to go to. It's amazing the stress that kids are under these days. So we put them in brain tap just to calm them down. Now Normatec, we started using Normatec with it, and this is our Normatec room. We started using Normatec for a couple reasons. There is an autonomic dysautonomia that happens, and these kids, and Logan is one, Logan started having a resting pulse rate of 88. And she is an athlete. But after her concussion, a resting pulse rate of 88, that's too high. She was still having sleep problems. And so we put her into Normatec, which is just compression therapy. It helps increase the circulation. But it forced her to relax. And so when we put her into Normatec and brain tap, she takes a nap. Everybody needs a nap, right? Every day. And so we got her into that, and all of a sudden she's starting to sleep better at night. Now we use Normatec in a lot of different capacities. It's basically a recovery tool by colleges and pro sports. We use it as neuromuscular re-education because we're affecting the receptors. So when the kids come in and we do balance testing, and what happens is they sit there and they fall over to the left, it's the left cerebellum that's not functioning right. So we bombard them with Normatec on the left and get those receptors firing, and we help them with their balance issues.
So is the basic mechanism of Normatec is basically afferent stimulation on a gentle level?
Yeah, except they never thought of it that way. It's basically used just for recovery after a hard workout.
But is that?
But that's how we use it.
How did you find out? I mean, just through.
How did I do it?
How did you find out about this?
Normatec?
Yeah.
We have well, I was watching back in 2016, I was watching HBO Hard Knocks. And they had the Los Angeles Rams when they first moved out there, and a kid got hurt. They had him in the athletic training room, and he had those things on. Well, we have a kid from Gaylord that was an athletic trainer for the New Orleans Saints. And I sent Pete a text. I said, what's this Normatec stuff? He goes, oh, you got to get it. Well, I started researching it. So we bought one pair in 2016, and we used it for the athletes. I wasn't even using it for concussion care. We just used it for our athletes and for our patients that had sciatica and neuropathy, all these clinical conditions. And it worked. So then we got another set. Well, Brain Tap had a big summit down in North Carolina a year ago, and they asked me to come down and talk. And I talked about autonomic, basically sympathetic syndrome in high school athletes, kids that were choking, in sports. I said it's running rampant, and how we use Brain Tap to calm them down. Because Brain Tap has about, 20 different sports recordings to help these kids get ready. Because kids don't visualize anymore like we used to. So on the way home, I'm thinking I can use Normatec as a neurological aspect because it's receptor-based. Are you a functional neurologist?
No.
Yeah, you are. You're a chiropractor. So anyway, we started using that, and we started getting really good results. So all of our concussed kids go into Normatec and Brain Tap. Okay, so I'm going to end with Logan's story. Logan was a sophomore in the spring of 2018 playing varsity soccer when she gets hit in the head. Gets momentarily dazed. Mom takes her to the ER. Same story. CT scan was negative. Everything was fine. They told her to go home and rest. It'll take time. Have you ever been to Gaylord? Okay. Our summers are like 3 days. So they told Logan throughout the whole summer she just needed to stay indoors, stay out of the sunlight, not go out. Well, she followed their instructions, and in July, she wasn't any better. Went to a neurologist, and they said, you've got post-concussion syndrome, it's just gonna take rest and time, keep staying indoors, don't worry about it. September comes around, school starts, Logan's not any better. Headaches, light sensitivity, dizziness, and her mother's at the grocery store and run into Brody's mom, and they start talking. Logan comes in and sees me in September. I knew Logan from basketball season the previous. It wasn't the kid I knew. Came in again, just depressed, anxious, sullen looking. She's in post-concussion syndrome. So after we did the exam, first thing we did, within 3 days, I got her on the Buffalo treadmill test, and then we got her downstairs and started working her out. Just light, dynamic stretching, and within 2 weeks, the headaches were gone. Within a month, pretty much her symptoms had cleared up 85%, so she was back to school, because she wasn't able to stay a full day at school. She was getting worried, because she's a 4.0 student, she was getting worried. She was really worried she wasn't going to be able to play basketball that year. So we got her back, and she was ready to play basketball. Up until January 15th, one of the few games that I wasn't at, when she took a hit on the head, landed on the head, and I guess you could hear the crash for a long ways away. I know that my cell phone started lighting up with text messages that Logan had another concussion. So she was back in, and we started the whole protocol all over again. Logan, the varsity, I started working with the girls' soccer team last year for the first time. The assistant soccer coach is the husband of a local family doctor in town. And he kept chirping to the coach, because I said, Logan's gonna be ready. She's getting close, she's gonna be ready. And he kept saying, well, Logan's having headaches, she can't come back. You gotta be headache-free for 2 weeks, MHSA states. No, they don't. There's nothing like that. I'll never forget the day that Logan came back. It was a pretty cold day, but word had spread around that Logan was gonna be playing in the game that day. And when she went in, the crowd, what there was, gave her a standing ovation. And I looked up, and her mother is crying. Tears are just going down, and she's pointing to me down on the sidelines. That's why I became a chiropractor. I've been involved in every type of scenario. I've worked in pain clinics, I've solo practitioned, acute car accidents, chronic pain. The most fun I've had in over 31 years of practice is treating concussed kids, because it's the most rewarding. There is no file reviews, there is no IMEs, there's no competition. They can't go get surgery, right? There's no medication. I didn't do any advertising. All I did was treat some kids twice just before I knew what I was doing, and I got them well with chiropractic care, and now I'm the expert in concussion up in Gaylord, Michigan. We treated 40 concussion cases last year. Now, what if I told you, and this is almost going to sound way too good to be true, because some of us came in to practice in the late 80s, okay? We've all seen dwindling insurance reimbursements and frustration from that. What if I told you there was an insurance coverage that paid 100% of your bill, that there was no IMEs, no file reviews, and they paid it 30 days after you submitted your file? Would you say you've gone to insurance heaven again?
You've got my attention.
Okay. Well, our wonderful state, the Michigan High School Athletic Association, was the first state in the nation to purchase separate concussion insurance for sports-related concussions. Grades 6 through 12, if they've been involved in a sports-related concussion, it's K&K Insurance out of Fort Wayne, Indiana, and they will pay. You run it just like an auto. You submit to Blue Cross or whatever, Whatever they don't pay, K&K will. And they will pay 30 days. Now what we do is we wait till we're done with the whole care and we submit one packet. In 30 days, we get some nice checks to the tune of about $40,000 last year. Now my frustration is that there are a lot of Logans, there are a lot of Brodies, there are a lot of Lindsays out there that are walking around and they don't have answers. The parents are looking for solutions. We are the solution. Chiropractic at its best. We should all be treating these cases and taking the leading role in this. Because if we don't, who's going to do it? Well, the PTs think they're going to do it, but we can do it. And we're a neurological practice. It's our profession.
All of the school programs have that as true?
Even the Catholic schools, yes.
I have one, and I had no idea that they paid it, because the mother was paying me, and just last week she goes, hey, can I have the receipts, because I'm gonna get paid back through, and I'm like, so now I'm like, shoot, I should be billing the insurance and getting
Yep.
it instead of her, because
Yep.
I mean, I was writing off a lot as a cash patient.
Well, and the other thing too is the parents, now that they know up in Gaylord, the parents aren't hesitant about taking them or bringing them in. The other thing, we don't have anybody dropping out of care. These kids will do anything I ask them to do, and the parents come in. We don't have anybody dropping out of care early because they want to get back to school, they want to get back to participation, and they want their lives back. Yeah.
How long have you been doing this?
Well, I've been the team doctor since 2002,
No,
but
your-
treating concussions,
Your concussion
2
protocol.
years.
And let me, so basically your protocols, you're adjusting the spine,
Mhm.
you're using the brain tap, which is imagery to calm the nervous system, you're using the
Normatec?
Normatec, and then a variety of neuromuscular rehab.
Right.
You know what, years ago, many of you guys are old enough to know, remember you guys that asthma study we did about 100 years ago?
Yeah.
If it's as good as you say it is, it would seem like a handful of us could do it and do a real study with this,
Yep.
just like we did the asthma study.
But we got to get everybody standardized. Now I'm going to give you the sales pitch. I'm working with Genius Solutions now. We've got an educational program. So anybody that is not happy with the current income level, maybe you don't want to get into concussion. It may not be for everybody. We have 2 programs, and then we have a Concussion Genius program. And the Concussion Genius program will get you all the equipment, training. You come up to my clinic many times you want. We train you up. We help you, unlimited support. You get back out and start helping a bunch of kids in the community. If you see auto cases, you can use the same equipment for the auto cases. You can use the same equipment for your Blue Cross Blue Shield rehab too. So I'll give you when did Blue Cross give us the pay deduction on manipulations? 2016, was it right around then, I think? They cut massage. Well, I started doing rehab. And we make more money on rehab, but we get better clinical outcomes. In my profile, I'm a good boy when it comes to Optum. So there's ways to give yourself a raise, but we got to change our way of thinking. It can't be the same old model that we're used to.
Do you know anything about the photobiomodulation, red light therapy?
No, I mean, I've heard of it.
Because when you started talking about ATP, that's exactly what it does, is it releases, the energy out of the mitochondria and helps in healing, and that's where I'm going with it a little bit. And then do you know Dr. Benson by any chance? Randall Benson? He is a neurologist who helped with the movie Concussions, and so he's he's a guy that I don't feel comfortable talking to for many reasons, but he's like an expert at it, and I'm just, wondering if he knows much about this. But he has people flying in from Texas. He's huge, and he's in West Bloomfield.
See, here's the thing too with concussions. You will always have a cervical spine involvement. You cannot have a concussion without cervical spine. Because G-forces wise, it takes 70 to 120 Gs to cause a concussion. causes 5 to 8 Gs to cause cervical spine. So you will always have that. So right now, you're equipped. Now, I will tell you this, the concussed kids cannot handle a diversified adjustment. And here's how I learned this the hard way. Logan came in, she was complaining of headaches, and C1 was shifted laterally to the right, and I gave her really what I thought was just the best seated adjustment, big old pop. She goes, wow, that feels great. Well, her and her mom came walking back in 15 minutes later because they had pulled alongside the road and she was throwing up. And what happened is I bombarded her autonomic nervous system. So I have Cox tables. I don't do any diversified on these kids. I actually have little pulsometers that I put on all the Cox patient, or the concussion patients when I'm doing my Cox work on them, and I'm looking at their pulse rate, because your nervous system will tell you how well they like the adjustment.
Well, red light therapy, laser therapy too. Do you ever do cold laser?
I don't, and I'm not, this is just me, I'm not a big fan of laser. These concussed kids, they need exercise, they need neuromuscular rehab, and it's low tech. There's a lot of low tech things that you can get. That's what they need. They need to get away from passive therapy. So you just do some suboccipital soft tissue work, a little rock blading, rock tape, and then you get them downstairs or in a rehab. And it doesn't matter what size office. You can put rehab in any size office and get it done. Get done.
Do you monitor heart rate variability?
Yes, I do. We have the Neural Infinity, and so we do heart rate variability, and we do, so the second day they come in, we do the full stress response evaluation. Then we have another thing called clinical Q, and so we do biofeedback and we do neurofeedback. These kids can't breathe. That's the other thing. Their heart rate variability, and again, parasympathetics and sympathetics are all out of balance.
And do you use a breathing protocol?
We do through Neural Infinity, yeah. Yeah, that's what the bio, and then, and then with the upper thoracic adjustments too. So
Are you doing manual upper thoracic adjustment?
I am really, but not. I'm going real easy with them.
Gotcha.
And we do a lot of instrument.
Regarding your pulse ox, are you looking at a baseline that you should not go above a certain, like, are you comparing a treatment versus their baseline?
When they first come in.
So what would you say acceptable adjustment, the body accepts this adjustment versus it's too much stimulation? How much over their baseline?
All right, so let's say they come in and they have a, let's say 72. I start to do the adjustment. If it spikes up 3 or 4, I'm backing way down.
Oh, really? That much?
Yeah,
Okay.
yeah. What we're keeping them, because there's a lot of these concussed kids that will go into POTS, postural orthostatic tachycardia syndrome. We haven't had that issue with Normatec, with keeping the circulation up, and then with brain tap, and then our neurofeedback also. Yeah, it's fun. It's a lot of fun. And again, you're making differences in kids' lives, and the parents are looking. They're searching for us. Yes.
Can you tell us about your initial diagnostic testing when you see a kid come in? Like,
Sure.
what are some of the neurological tests that you do to confirm the diagnosis?
Yep, so what we do, basically, the diagnosis of a concussion is based on the history and on the clinical symptoms. So if they have a headache, dizziness, concentration problems, sensitivity to light, sensitivity to noise, if they're anxious, if they're depressed, I think I said trouble concentrating.
All the things on the river meter.
Everything, yep. And then, so what we do, I always start all my exams out, cervical spine exam. And so you're gonna find restricted range of motion, you're gonna find suboccipitals that are very tight and tender. You'll probably find your compression test negative for radicular complaints, but localized pain. We do cranial nerve testing. You'll see that cranial nerves 3, 4, and 6 typically are a little jacked up. The eyes are all over and it's creating headaches. And then we will have them do, follow the eyes as back and forth and up and down, vertical. And they will get dizzy or they'll feel sick. And so they have eye problems. We use a system called Kinetisense, and it's, we can do anything with that, range of motion, but we do balance testing. So feet together, hands on the hips, eyes closed, and you see them start swaying. Then we do finger to nose, and they'll miss. We do convergence and accommodation. We have this ruler, comes in and they start getting all blurry and they get headaches, abnormal. See the cranial nerve, yeah, that's pretty much it. We do muscle testing, obviously, deep tendon reflexes. The biggest thing is the kids cannot, if they're trying to hide a concussion, they can't hide the balance issues. However, we do a lot of, it's great if you have baseline on them, and we do a lot of baseline concussion testing. The kids on the baseline are terrible with their balance. They're absolutely atrocious. And then we do some other things with the baseline. You know, one of the simplest things that we do is have them recount the months backwards, opposite order. You'd be surprised how many kids can't do that. And this is when they're normal.
Does that Kinetisense, is that an objective testing? Is it?
Yeah, it is.
It puts a number on it?
It puts a number on it, yeah.
What are you testing with that one?
You can do, it's a video functional, you almost create your own movement laboratory with it. So you can do range of motion, you can do balance testing, and you can do functional. So if you have somebody that you want to test for squats, or you can have them pick it up in your video test and it shows a little avatar and it gives them a score. We have
Is there a concussion?
just the balance. The balance.
Just the balance?
Yeah. It gives you numbers.
Okay.
And anytime you can get to numbers is going to be good, because now you got a baseline, and I'm constantly telling the kids, all right, here's where you're at. You did.
You use it through your laptop or like a posture
Yeah.
aid? Is it similar?
Yeah.
You familiar with posture aid?
Yeah, I used to use that, and I upgraded to Kinetisense because I thought it was a more powerful program.
Okay.
Yeah. Yes.
You have them doing the brain tap and they're laying, it looks like a Chase Lounge chair.
Yeah, I went to Rent-A-Center and I bought used recliners and I put them in the room. Now, the Normatec room is actually Normatec gravity chairs. We got 5 of them, and that's our Normatec room. We put them in there and put them in the Normatec, and they all get brain taps.
Are they all separated or?
Yeah. Well, it's one big room, but they know not to talk. Okay. Now
How long are they doing that?
It can be 23 minutes for one of the recording. It can be as low as 10 minutes to 23. Yeah.
Is the Normatec, is that like $1,500?
It's about about 1,200 for just a set of legs. Yeah.
What's the cost for everything to do your protocol?
3,500, and I will get you Normatec, motion guidance.
What's motion guidance?
Let's see, that's my other neuromuscular. It's a laser. Put a laser on the head, and they have to do neuromuscular re-education. Let's see if I can.
All right, Doc. Here's the bad question. You get a piece of this.
I don't know if it's still. It was in the segment. Let's see. You get Normatec, brain tap, motion guidance, Otis. What else is it? And then training with me, and unlimited support. You come up to the clinic and you can train as many times you want. I want a network of chiropractors. My goal is to get at least 100 in this state. Because then now we can go to the MHSAA and say, we need to be telling these kids when they can go back. Because quite honestly, the ATs, the athletic trainers, I mean, they do a wonderful job, but they don't know what to do. There's another program, if you want to take it to the next level, is complete concussion management. And that's where you learn how to do the baseline and even more about concussion. So that's the master's degree at that point. Now, you don't have to have the relationship with the high school like I do. All you need to have is kids that are, parents and kids that are playing sports. And then if you want to take it on and get your clinic certified with CCMI, then you can start doing baselines. And here's what we did. We don't charge for the baselines. Kids come in, parents come in, and it's like the old-fashioned spinal screenings. It is the best. So So guess where they go if they have a concussion?
Yeah, right.
Because we have their records, we have their baseline.
How long does it take to do a baseline?
Takes about 20 minutes, 25 minutes, and you have a couple staff doing it, and CCMI will run you through that.
What's CCMI stand for again?
Complete Concussion Management, Inc. And it's founded by a Dr. Cameron McKay. He's a chiropractor, and they're up in Ontario.
Is there any limitations to like, you know, the insurance, like saying that you're only allowed 34 visits or?
There's no limit, except you have 1 year from the date of injury. That's it.
And then they have to be released within that year.
Well, they won't pay. You don't have to relieve. You can keep treating, but you don't, they will not pay after that. We have one girl that her concussion occurred in April, right? She's still treating with us. But she had pre-existing anxiety and depression and ADD, and that slows the recovery.
One more question. I have a patient that is a college student and she's going to school in Tennessee, but I think the concussion occurred here, but she's gone. So what happens with who's responsible for insurance then?
She would be.
She would be.
Yeah, yeah. She's in college.
No, she's now in college.
When did the concussion occur?
She's had a couple. So one was.
Okay, if it's been within a year, possibly you could, but anytime it's over a year, then it's over.
And if it's out of state, then it doesn't cover.
Right. Now, here's the thing that's really cool. They pay up to $25,000 for mild traumatic brain injury, which is a concussion. But if it's serious traumatic brain injury, K&K will pay up to $250,000. So our state was the first. Now there's about 8 or 10 that have adopted it.
You said earlier about 30 days. I thought you mentioned 30 days.
Just to get paid.
30 days to get paid.
Reimbursed.
Yeah, once they receive it, they will pay you in 30 days.
But you said you wait the full case.
Until you release them, you put the whole thing.
Yeah, then I put it all together. I just like getting big checks.
Full year.
Who do you bill? Is it the?
You bill, you run it like an auto case, so you would bill whatever the primary is, and then it goes on to K&K Insurance out of Fort Wayne, Indiana.
So your daily notes are pretty copious then?
Like they should be, like, you run them like an auto, basically, yeah.
Now, your protocol is based on what? Who again, is that through you? Are you certified?
My clinic is certified. We were actually the second in the US to become certified with them.
Okay.
They're big in Canada and England and all over the world, but they don't, I treat aggressively.
I get it.
These kids, here's the protocol. Kid comes in, and we just had a cheerleader the other day, came in. And so she's out of school for 3 days, automatically. They're out of school for 3 days. First day back, they go a half a day. No test taking, no new content. They just sit in class, see if they can handle it. If they can handle it, they go for a full day the next day. If they can handle that, they go back, they can go do whatever they want, test take, the whole works. When they go back to school full-time, then we do a Buffalo treadmill test to see physically, functionally, what they can do. But I'm treating them daily through this whole time. Why give them a day off? I want to get them back. So they're getting adjustments, they're getting therapies, they're getting brain tap, they're getting Normatec, they're getting rehab, and I'm monitoring them. And then when they're ready to go back to participation, we start them back on our return to participation protocol.
Is any, like for instance, is there a governing body, and I just want to have an understanding of this. Like for instance, is there this sounds very novel. We got a couple brilliant brain-based chiropractors here that do all the functional neurology at a higher level. You know, we have programs in the ICA deals with whiplash and trauma. Is there a governing body that this is through? Like for instance, is there a credentialing governing body like the ICA, trauma? Like for instance, the guy in Ontario, what is he through? And he could, don't get me wrong, he could be a great guru, right? But I'm just saying, is there anyone on top of this?
No.
Okay.
And that's because it's so new.
That's fair.
Now, you brought up a good point, though, because you talked about the functional neurologists. this is, you have to develop a team. Now, we refer to local optometrists all of our concussion kids for visual assessment. I'm not equipped to do all the visual work, and a lot of times they need that. If it's a bad enough case, then I will refer to a functional neurologist. What a beautiful way to refer within our own profession. Because the functional neurologist, the carrot guys, they do some amazing things. So if it's a bad enough injury, I'll refer them. And sometimes I'll refer down to right here in it's Bo Doubleday. He's either in Kellogg or Battle Creek, I can't remember. But then another one, Neurolife Institute out of Atlanta, Dr. Michael Longear. Smart guy, great guy. And they do some amazing things.
And you've seen 40 cases, and are you happy with the results you've gotten with the cases doing? This sounds like simple and basic, but effective. Is that a good way to it?
Yeah, for the cases I'm seeing, if I've had any that come in that are really, really tough, I'm gonna call in the team.
Okay.
But it's typically not gonna be, the MDs aren't gonna tell me anything.
Got it.
You know, not that I know everything, but they have nothing to offer me that's gonna help these kids, because they're still recommending rest in time.
For what it's worth, Dr. Benson is my wife's neurologist, and while a brilliant guy, he's not really a treater. He doesn't really even manage the case. He's good to have on your team because he's a brilliant guy, he's Harvard trained. We got a couple functional neurologists over there, bright guys. We found them helpful to my wife.
Yeah.
So we got a couple guys here that are good. But as far as, and I would have Dr. Benson on my team if it was a legal issue. I'm not sure he would give much guidance. Like,
I'm not comfortable with him.
yeah, he's brilliant. I mean, he's odd, but he's a brilliant guy.
Thanks for putting the odd in
No,
there.
he's fucking odd.
But see, these are functional
I get it.
injuries.
I get it.
Right? So we need, when they get to a certain point, we need to get our experts in our own profession involved.
I think this is great.
Just so everybody in the room is aware of Dr. Michael Smello over here. He's certified.
Stand up.
Good character, right?
All right,
Both those guys are, yeah, both.
okay, get this guy's card, get their cards. We have to start referring, because there's a lot of these conditions.
In your experience in 3 months, what % improvement would you feel comfortable, and what % would you say, hey, dude, I'd prefer to go further in your experience?
If we have, so far, I've been very blessed with having cases resolve. The only ones that didn't resolve were the first two that I.
In 90 days, what are most of your cases? What % improvement are you saying there?
In 90 days?
90 days.
They're 75 to 80%.
Okay. All right, that's the number I want to hear.
Yeah.
Okay. Have you had any chronic? Not acute, but chronic people that have had.
Well, I got Mary right now that's post-concussion that's coming up on a year.
In other words, you're seeing them a year after the fact, 6
A year?
months after.
Yes,
Okay.
yes.
How you doing with those?
Well, once we get them up and moving around, we have good success because they've been told just rest in time.
Are you still at the 75, 80% at 90 days with
I've
those?
only had a few.
Okay, fair enough.
Okay, so I don't know where I'm at yet with those.
Fair enough.
And that's the reason we're doing, I'm still learning like neurofeedback, because I think neurofeedback can be a valuable tool to help these people with these brain dysfunctions. All right, anything else? All right, thanks for having me.
Thank you so much for coming, Dr. Arkfeld.
Thanks, Dr.
And thanks everybody for being here. Make sure if you didn't sign in, go ahead and sign in at the table here. Well, our next meeting will probably be in a couple months. We're trying to do 4, 1 per quarter. And if anyone has